Today, we're going to show you how to file a claim for anxiety related to military sexual trauma using the Before You File guidebook. So, what will we show you? So, what we'll do is show you how to use this Before You File guidebook to file for anxiety related to a military sexual trauma event that took place while you were in the service. We'll show you how to find the rating for that condition. And then also, we have the Before You File course. Once again, today we're going to talk about anxiety from military sexual trauma. So let's get right into it. Okay, so here we are at the Before You File VA Disability Claim Guidebook. All right, and that's available on the website in that helpful veteran section. This just gives you an overview of what the guidebook helps you do. Let's get right into that first condition. Once again, we're going to be filing for anxiety, insomnia, and depression related to military sexual trauma that took place while we're in the service. All right. So, what is the condition that you're filing for? So, we'll put anxiety, insomnia, and depression. Were you diagnosed with this condition in service, or is it the result of an event that took place in service? It is the result of military sexual trauma that took place while in the service. All right, so that's question one. Once again, filing for that anxiety, for that insomnia, and for that depression as a result of military sexual trauma that took place while in the service. All right, that's question one. Question two, do you have evidence of this diagnosis or event from while you were in the service, and what is the evidence? All right. So in this situation, if the event was reported, you would just present that documentation, right? Just list the date on that report, and you can get that from the base, from your base if you reported it to the base, or from the local police if you reported it to the police. And in the case that there is no evidence, what you can do would be get testimonies from people who served, right? And your personnel files as well could also show what are called behavior markers. If there was like a drop in your productivity, you started getting in more trouble, things of that nature, then those would be considered behavior markers, right? I've personally seen multiple examples where there was no reported evidence, like they didn't make a report when the incident happened. But the behavior markers and the statements allow them to still be able to get that approval. All right. So let's say in this situation, there is no reported incident. No reported incident. I have two statements from fellow service members, right, who served with you during that time. Also have my personnel file showing a drop in behavior following June 18th. 2017, right? June 18th, 2017 is the day the incident took place. So what we're saying is in this situation, let's say you were squared away prior to this, not getting in any trouble, doing well. And then after this traumatic event took place, now your productivity dropped, you're showing up late, insubordination, getting into more conflicts, right? Things of that nature. So those would be behavior markers, right? Showing that even though you didn't report it, it is likely that something traumatic happened that kind of sparked a change in your behavior. All right. So that's question number two. We'll go to question number three next. Do you have medical records showing a diagnosis of this condition since you separated from the service? All right. So in this situation, I would say yes. We went to the doctor for the anxiety, the insomnia, and the depression, and got diagnosed in April of 2020. So yes, got a diagnosis for anxiety, insomnia, and depression in April 2020, right? Separated in August 2019. Okay, do you have medical records showing a diagnosis of this condition since you separated from service? Yes, got a diagnosis for anxiety, insomnia, and depression in April of 2020, separated in August of 2019. All right. That's question number 3. Let's go to question 4. What is the date on the medical record showing your first diagnosis for this condition since you separated from service? All right. So that was April 8th, 2020 is the date of first diagnosis since separation. What is the most recent medical record showing your diagnosis for this condition since you separated from the service? Okay, most recent time I went to the doctor, most recent visit to the doctor was November 2023. Was November of 2023. All right, so April of 2020, April 8th, 2020 is the date of the first diagnosis since separation. I guess that's spelled incorrectly. Since separation, the most recent visit to the doctor was November of 2023. How many years are there between your separation date and the date of your first diagnosis for this condition since separation? So first diagnosis was April of 2020, separated in August of 2019. So that will be less than a year. Less than 1 year from separation date to date of first diagnosis. All right, so that's less than 1 year. So we'll go to question 6. Have you looked at the rating schedule for this condition? So we'll look at that now. We'll go ahead and put yes. After looking at the rating schedule and at your medical records, which rating does your evidence support? And the reason we put and your medical records is because that's what matters, right? So what we're trying to really stress is that when you're going to your counselor or your doctor, make sure you let them know everything that's going on. All right. You want to try to be honest with them about all the things, and it can be difficult to talk about, but we do encourage you to kind of let them know everything that's going on so it can be documented and it can be considered when they're rating your claim. All right. So now we'll take a look at the rating schedule. Okay. So here we are at the rating schedule for mental disorders. All right. And once again, we're filing for that anxiety, insomnia, and depression due to a military sexual trauma event that took place while in the service. Uh, so, what you want to do, once again, is just kind of look through and see if any of this kind of matches up with what you're experiencing, right? Some of the things you're dealing with. Occupational and social impairment, right? Having trouble at work, having trouble socially, with family relationships, if you're doing any obsessional rituals that kind of interfere with your routine activities, right? You want to let that be known. If there's any speech issues, any memory issues, spatial disorientation, neglect of personal appearance and hygiene. Once again, if these things are going on, it definitely could be difficult to talk about. But we always will stress that you do share these things with your counselor or your therapist because this is what the VA will consider when they're rating your claim. All right. So let's say we're having some occupational and social impairment with reduced reliability and productivity, right? You're showing up late to work sometimes. It's a struggle to get up and go do things. It's that flattened effect. Um, Once again, short or long-term memory issues, difficulty in establishing and maintaining effective work and social relationships, right? So if these are some of the things that you're experiencing, that's why it's helpful to come to the rating schedule just so you can kind of see if this kind of lines up with what you're experiencing. And you want to make sure you're getting that documented with your therapist or your counselor. All right. So let's say in this situation, we're dealing with some occupational and social impairment. We do have some impaired judgment, um, panic attacks, frequently, sometimes kind of getting overwhelmed with that anxiety. Um, and let's say a little bit of a short-term memory memory loss, short-term memory issues in terms of retention. All right. So based on the rating schedule, we'd say if we were dealing with these things, we kind of expect a 50% rating. All right. So once again, we want to make sure that it's in the medical records, but this would kind of be the expectation is that 50% rating. All right. So now we'll go back to the guidebook. Okay, so now we're back at the guidebook. Have you looked at the rating schedule? Yes. After looking at the rating schedule and at your medical records, which rating does your evidence support? Okay, so based on occupational impairment, social impairment, reduced reliability, some memory issues, common panic attacks as well, nightmares occasionally. I believe I will likely receive a 50% rating. All right. So just saying, based on looking at the rating schedule and knowing what you've been dealing with and what you've let your counselor or your therapist know about, you would be expecting around a 50% rating. All right. But maybe more, maybe less, but you want to have an expectation going in. Right. Based on the evidence I have, I feel like I should be able to get a 50% rating. Right. Maybe more, maybe less. So if it's less, you can do that reconsideration to get it leveled up. And if it's more, then it's more. All right. Occasionally spelled wrong. I'm not, is it the S? Okay. Okay. All right. So that would be the last question for that claim. But once again, it kind of helps you to package everything, get it clearly in your mind. So when you're going to file that claim, you're squared away and you know what to expect, right? Most importantly, you're going in there with a clear expectation. And then that experienced person that you're working with can kind of guide you after that. All right. And in between each section, once again, there are different things to remember, just kind of some reminders for you, right? To take advantage of the benefits and resources available to you, and a link to that rating schedule, pretty easy to find. And then doing that control F function so you can navigate it and find whatever keyword it is you're looking for, right? Once again, trying to make things a little clearer for you so you can be more confident and be more productive while you're filing that claim. All right. And that is it. The guidebook is available on the website in the helpful veteran section. Right. You can link to it in the description of the YouTube video. And as always, learn the information, use the information. And if you deem it to be valuable, share the information. All right. Hey, have an incredible day.